Imagine waking up every day with a back so stiff that even the simplest movements become a challenge. This is the reality for individuals living with a condition known as ankylosing spondylitis, or AS for short. AS is a chronic inflammatory disease that primarily affects the spine and sacroiliac joints. It's characterized by persistent pain, stiffness, and in severe cases, a progressive fusion of the vertebrae. This condition often rears its head in late teens to early adulthood, starting with recurrent episodes of lower back pain and stiffness that worsen over time. But it doesn't stop at the back. AS can also involve other joints like the hips, shoulders, and knees, leading to more pain and stiffness. And because it's a systemic disease, it can even manifest in symptoms like fatigue, eye inflammation, and in severe cases, cardiovascular complications. Ankylosing spondylitis is not just a back problem, it's a systemic disease that can affect various parts of the body. Ankylosing spondylitis often starts as a whisper, with subtle signs like recurrent lower back pain and stiffness, but it can evolve into a roar, leading to fusion of the spine and limited mobility. This chronic inflammatory disease commonly makes its debut in late teens to early adulthood, often creeping in unnoticed. It manifests initially as episodes of lower back pain and stiffness, particularly noticeable in the mornings or after periods of inactivity. As the disease progresses, the inflammation intensifies, potentially leading to the fusion of spinal vertebrae. This fusion results in a stooped posture and limited mobility, significantly impacting an individual's quality of life. Picture this: a once supple bamboo, over time, morphing into a rigid iron rod. That's the spine under the relentless assault of ankylosing spondylitis. However, the battlefield of ankylosing spondylitis is not confined to the spine alone. It can extend its influence to other joints, such as the hips, shoulders, and knees, instigating pain and stiffness. But this malady does not stop at joints. Its systemic nature allows it to manifest in extra-articular symptoms like fatigue, eye inflammation, known as uveitis, and even cardiovascular complications in severe cases. It's a disease that refuses to be boxed in, spilling over into multiple arenas of the body. Now, the million-dollar question: what causes ankylosing spondylitis? The exact cause remains unclear, but the consensus is a cocktail of genetic predisposition and environmental factors. The evidence points towards the human leukocyte antigen, HLA B27 gene, found in the majority of people with the disease. But not everyone with this gene develops ankylosing spondylitis. It appears that environmental triggers like infections or trauma might act as the spark in the tinderbox of genetically susceptible individuals. In conclusion, the progression of ankylosing spondylitis can be subtle and slow, but its effects on an individual's quality of life can be profound. It starts as a whisper in the back but can crescendo into a symphony of systemic symptoms. The challenge lies in early detection and intervention to turn down the volume of this symphony before it becomes a deafening roar. While there's no cure for ankylosing spondylitis, advancements in medical treatments and therapies have revolutionized the way we manage this condition. The primary goal of managing ankylosing spondylitis is to alleviate symptoms, prevent complications, and maintain function. Let's dive deeper into the treatment options. Non-steroidal anti-inflammatory drugs, commonly known as NSAIDs, are often the first line of treatment. They are effective in reducing pain and inflammation in many patients. However, for those with more severe symptoms or who do not respond adequately to NSAIDs, biologic therapies have come to the rescue. These therapies target specific inflammatory pathways and have revolutionized treatment outcomes. For instance, tumor necrosis factor inhibitors, or simply TNF inhibitors, have shown efficacy in reducing disease activity, preserving spinal mobility, and improving quality of life for many ankylosing spondylitis patients. Beyond medications, physical therapy and regular exercise play a crucial role in managing ankylosing spondylitis. They are instrumental in maintaining joint flexibility, strengthening muscles, and improving posture. But treating ankylosing spondylitis isn't just about medication and physical therapy. It's also about patient education and support. Understanding the disease, recognizing early symptoms, and adhering to treatment plans is essential. Patients who are well informed about their condition are more likely to stick to their treatment plans and make necessary lifestyle adjustments. This proactive patient engagement can significantly influence the course of the disease and the patient's quality of life. Moreover, early symptom recognition allows for timely intervention, which can help slow disease progression and prevent complications. This emphasizes the importance of regular checkups and open communication with healthcare providers. To sum up, the management of ankylosing spondylitis is a comprehensive approach that involves medication, physical therapy, and patient education. It's a team effort, with the patient at the center of the team, working alongside doctors, physical therapists, and support networks. Living with ankylosing spondylitis can be challenging, but with the right treatment approach and patient engagement, it's possible to maintain a good quality of life.